Hello everyone, welcome back. Today we'll be looking at stages of wound healing, and with this simple mnemonics we can know the stages of wound healing. This mnemonic is VIP room. V for vascular, I for inflammatory, P for proliferative, and R for remodeling and contraction. Vascular involves formation of fibrin plaque. Inflammation involves the infiltration of the wound with inflammatory cells, which occurs in the first 72 hours. We have neutrophils. In the first 3 days, we have macrophages. By 6 days' time, we have lymphocytes. Then for proliferation, it involves the reapplication of the wound surfaces. Then for remodeling or contraction, it involves the contraction is greater at the 5 to 15, but by 8 weeks, we have 70% of the tensile strength recovered. Now, stage of wound healing. There are 3 main stages of wound healing. With VIP room in mind, we can stage wound healing into 3 main stages, and it involves exudative stages, proliferative stages, and remodeling stages. Exudative stage involves hemostasis, where there is vasoconstriction to limit blood loss, and there is also release of inflammatory mediator, which include growth factors, chemokines, and cytokines, which activate platelets, forming fibrin plaques. There is also inflammation. Inflammation helps to clear cellular debris through phagocytosis. There's also the migration of inflammatory cells that facilitates tissue regeneration. Then for the second stage, which is proliferative stage, there's granulation formation. This is the laydown of new connective tissue and vasculature. It's the fibroblast growth factors helps in promoting cellular proliferation, while the vascular endothelial growth factors helps to promote angiogenesis. Now for remodeling, it modifies the wound content to increase its tensile strength. It may last for years after an injury. So apostasis of excess cells occurs. There is also the degeneration and alignment of collagen fibers. Now these are timelines for wound healing, starting from the first minute to the 2 years time. Now timeline and stage of wound healing, as you can see and have been explained. Day 1 we have fibrin clots, we have hematoma, we have neutrophil infiltrates. We have day 2 we have squamous cells C of the wound, we have macrophages migrating to the wound. Day 3 we have granulation, tissues begins to form. We have initial deposit of type 3 collagen. We have macrophages replace neutrophils. Day 4 to 6 we have peak granulation tissue formation. We have fibronectin, that's a key glycoprotein used by cancer cells to metastasize. Now by week 2, our tensile strength is about 10%. By 1 month time, we have remodeling of the wound, and we have the tensile strength approximately 80% in 3 months. But we should also note that in wound healing, the tensile strength can never reach 100% after an injury or after a trauma. Thank you very much for watching.